Hi guys, thanks for having me. Can you all hear me at the back? No? Okay. I'll try to speak really loud. How's that? Yep. Okay, as you said, my name's Tony Marie. I'm one of the educators at the Mater and specifically to do with baby first aid. And I'm here today to talk to you a little bit about first aid for babies, specifically how to recognise an emergency and how to resuscitate, just in case you need it. Let's hope you never do, but just in case. Now, Mater Mothers is Australia's leading maternity hospital, so we deliver about just over 10,000 births a year. So you could say babies are our thing. So that's why we wanted to share some of the knowledge that we have with mums and dads and grandparents to make sure that we can, empower you to care for your baby when you get them home. All right. So has anyone ever been in an emergency before? That's right, I'm not going to ask you to explain it. No. If you have, you'd find that your adrenaline kicks in, doesn't it? And all thought and rational thinking goes right out the window. Would that be accurate? Yeah, and that happens the same with everyone, no matter how you're trained or what you do, everything goes. So what happened is years ago, the resuscitation councils came up with a little flow chart. And my little clicker decided not to work. There you go. Came up with a little flow chart to make it easy for us to remember. I don't think you guys can hear me very well. So what they did is they came up with this little algorithm, Doctor's ABC. Have you heard of that before? It's so that in an emergency, all you have to do is remember the letter, and then subconsciously you actually remember what to do. So that's what we're going to go over today, just a little sample of that. All right? So D, danger. That just basically means have a look. See if there's any danger to you, because imagine this. You see your 10-month-old face down. What is your first reaction? What do you want to do? Would it be get there as quick as possible? Yeah, which would be the normal reaction. Problem is, if you go very quickly and haven't checked for danger, what if something takes you out before you get there? Then no one's going to save your baby. So the idea is danger, have a quick look for anything that could stop you getting there. All right? And also any danger to your child, because people don't realise that if you actually jump in and do something without having a quick think, you actually could make it worse. All right, so stop, have a look at the surroundings, calm yourself, and then move in. Other things that are considered dangers are the location, traffic, or body fluids. Now, generally they're your babies, so that's probably not an issue in this situation, unless there's other people involved. And there's also the danger of other bystanders. Now, it's not so much that the danger is to them, but the danger can be them. People wanting to help, have you ever found that? Everyone wants to rush in and help, but maybe they should just take a minute to stop. So that's your thing, danger. Tell everyone, just wait, have a look, and then we'll go forward. Most important thing. Then the next thing, response. We want to find out that the baby's not just asleep. If you're a new parent or you've have a baby, can you admit that you will always watch them sleeping and going, are they breathing? Are they breathing? Everyone nodding? Yes, of course. That's what we all do, because it's like, I can't see the chest moving. All right. So what you want to do is make sure that they're not actually just in a deep sleep and you are freaking out for no reason whatsoever. All right. So response. In a child, a bigger child, like a toddler, we could touch them and talk to them and say, open your eyes for mummy, open your eyes for daddy, come on. Make a bit of a noise and they'll startle, all right? You'll break them up, but at least you'll go, yep, they're all good, nothing's really wrong, all right? But if they don't respond to that, then it's a bit more, come on, wake up for me, all right? With a baby, you can't really say to them, open your eyes and they'll obey you, can you? So you have to look at some other things. You have to look at, are they crying? Now, I know you want them not to cry, and it's really actually quite distressing when you hear them cry. Thing is, if they're crying, air's going past their vocal cords, so they're breathing. So you just go, right, cry all you like, little one, it's okay. All right, so you take that. Also, we look at their tone. Now, have you all seen a rag doll before? All right, rag doll means they're like this, all floppy, no muscle tone. But in a baby that's just asleep and not actually very ill, they'll have tone. See that little one on the screen? He actually still, even though he's sound asleep, his arms are up like this. He has tone. Whereas a baby that is unwell will just be all floppy. All right, that's your sign that no, they're not asleep. I'm not imagining it. Something's not right. All right, so we've checked that. So we've gone, no danger, check Bubby's response. If they're awake and alert, you don't go any further. But if they weren't awake and alert, that's where we need to go further. The next thing we want to do is get some help. Do not manage this on your own. The quicker you call somebody, the quicker they'll be there. And now in Australia, we call 000, or the 112 number is actually, can use anywhere in Australia. It's also international. And there are certain things that you have to say. And please do not worry that you're not going to remember what to say other than, my baby's not responding, I need an ambulance. Everything else they will prompt you for. And they will stay on the line so that you know exactly what to do and you're not alone. Because that's the comforting thought, not managing any of this on your own. Okay? So send for help. Then what we want to do is check their airway. Because with little ones, if you've got little ones already, you'll realise everything they pick up goes in their mouth. All right? And some things shouldn't go in their mouth and they go a little bit further down. So a reason that they might be unresponsive and not breathing is because they're just choking on something. So we might want to get that out. All right? So first of all, we have to have a look. Now, I'm sure you've heard in an adult, we actually tip their head back, have a good look. In a baby, we can't do that, all right? So just think if it's a bigger child, so over 1, all right? You want to grab their chin and open their mouth and have a good look, all right? And just tip their head back a little bit, child over 1, all right? Have a look. There's nothing there. If there was something there, we would then apply the techniques for choking, which we're not actually covering today. But if you did first aid, it would be the turning them over and hitting them quite firmly to get it out. All right? If you can't see anything, still just open their airway by pushing their head back and see if that works. Now, on a baby under 1, what you have to do is you don't extend their head because everything's so soft. And if you do that, you'll actually close their airways. So we want to keep them open. Have you ever smelt fresh bread cooking? What's the first thing you do? Yeah, some of you already did it. Your nose just goes, just this tiny sniff because you want to get that smell in. Right? That's called a sniffing position. So on a baby under 1, we want to give them a sniffing position. So use your finger, have them on a firm surface if you can, and just lift their chin. And I'll hold the baby up. So that instead of a head tilt, it's actually just a little tiny maneuver to make their head look like it's sniffing. It's very subtle. And you're doing that with your finger, okay? It's very subtle. So just like that. Still nothing, okay? We know it's clear. They're just not responding. So now we move to the next step. And the next step is, are they breathing normally? Now, what we mean by normally is they're not doing, like, sometimes this will happen. They'll breathe and they'll go, and you go, yep, they're breathing. It's all good. Has to be breathing normally. So not excessively noisy and not really slow and laboured. That's still not breathing properly. So we now actually have to help them. All right? So the way you do it is you look, listen and feel. So you look at their chest. And actually on a baby, it's easier to watch their tummy because their tummy's so big. Okay, you can even feel it if you want. Looking for them to, the chest going up and down. And then you listen and feel. Get your cheek down. This is where I knock my mic, right? All right. And you're feeling for air coming out as they breathe, and you're looking to see if their chest rise, and you're seeing if you can hear it. And if you can't hear anything in about 10 seconds, it's not happening. All right. So now we know they actually need further help. All right. So we've gone danger, there's none, they're not responding, we've called for help. The airway's open, there's nothing in it, but they're still not breathing. Our next step would be to actually start resuscitating them. All right. Now remember, ambulance is on its way, so we've got help coming. We want to start. Now your heart, all right, baby's heart, everyone's heart, is just a muscle that if we squeezed it, because it's a pump, it would do the same thing as if it was working on its own. So what we need to do, it's not working, so we might just squash it ourselves. And we can do that by pressing down on the baby's chest, and it squashes the heart between the backbone and the chest bone. And so we can artificially make the heart pump till somebody gets there with emergency skills and medications and things like that. So to do that on a baby under 1, okay, firm surface. Do not do it on a bed because it's too soft. All right, it has to be kitchen bench, table, somewhere nice and high for you. Nothing else around the floor will do, but you're just trying to make it easier on yourself. And then you use 2 fingers, these 2 fingers, and you're going to go this lower half of the chest. Don't worry about measuring, just go chest is there, lower half. All right, and you press down 1/3 the width of their chest, so it's actually quite high, like it's actually quite firm. It's just the desk is too high for me. All right? And we're going to go 1/3, and we're going to go to a rate of 100. Have you all heard that Bee Gees song, Staying Alive? Yeah? I'm going to sing, and I can't sing. So it's like, staying alive, ah, 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 ah. It's the right beat. It's the right count. I don't know if they actually realised that when they wrote it, but it's been used really well for CPR. So that beat in your head keeps the right rate. So 1/3. All right. Now, obviously, you just don't do the compressions, do you? You have to get some breathing in there. So what we want to do is have about 30 compressions to 2 breaths. All right. So when we do their breathing, all right, little ones are nose breathers. All right. So just covering their mouth's not enough. And the space you'll find is actually quite tiny, so it makes more sense to wrap your mouth around their entire mouth and nose. All right. So you're going to do that. You're going to have your finger on their chin so that they're in that sniffing position. You're going to place your mouth over their mouth and nose and blow in just the air from your cheeks. So it's like you're blowing out a tiny candle. It's not a lot. Right? You're doing it so that enough to make their chests rise. Right? So you'll blow it in and then look at their chest. Right? Now you probably couldn't see his chest rise from there, but I could. So now we want to do that as a ratio. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And you keep doing that until someone arrives to help and take over, or baby starts to respond. Now, respond means starts to move, make noises. You know, they're not going to wake up and go, "Mummy, get off." It'll be more of a type of thing. Okay. Right. So let's put this together. Now I need a dad to come and help me. Any dad want to have a go? As a prize? No, it's a mum then. Somebody does want to come and do it with me? Oh, you're all afraid. All right. We'll put it all together. So we've walked in, baby's not looking, you know, you should have woken up by now, you've gone in and gone, something's not right. All right. What's the first thing we're looking for? Danger. Anything around. If it's in your own home, it probably isn't any danger, so no danger. What's the next one we're looking for? Response. So is Bubby awake? Come on, sweetie, open your eyes. Nothing. And baby's a little bit pale, a little bit floppy. Now I'm a bit concerned. I'm going to grab my mobile and I'm going to call what number? 000. Okay, and I'm going to tell them, baby's not responding. I need some assistance. And they'll go, okay, where are you? Please put us on speaker. And they'll help you. They'll remind you actually what to do. All right. What's the next thing I do? A, check their airway. Make sure there's nothing in there. No, nice little sniffing position. Nothing. All right. Now what do I do? So next step, B, check for breathing. I'm looking, I'm listening, I can't feel anything, I can't see anything. So baby's not responding, not breathing, is pale and floppy. I now need to start CPR. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And when do I stop? I don't, until somebody turns up medically to help me or baby starts to respond. And hopefully, you know, the quicker you do this, the quicker you get in and start, the quicker it is for baby to come back. Don't wait for expert help to arrive. You can do this yourself. All right? I've given most of you a piece of paper. Stick it on the fridge. Just as you walk past, start to remember doctors ABC, doctors ABC, doctors ABC. And you'll find that in an emergency, you'll freak out for a minute, but then you'll go, doctors ABC, and you'll remember. Trust me, it works that way. All right? Now, because nobody wanted to have a go, I can't give away my prize. I have to keep it myself. All right. Do you have any questions about any of that? Oh, I was so good at it, there's no questions. If you actually want a hands-on class, because honestly the way to learn to do that is do it. If you go to the Marta stand and get one of their bags, there's a brochure in there about all the baby first aid classes, because babies are different. They're not little adults. You can't employ the same techniques onto a baby, and they respond differently. Right? So if you really want to get a hands-on class, go grab your bag and that. Otherwise, I'll be around if you want to ask any questions, pick my brain. Otherwise, oh yes? Firm surface, because if it's on a soft bed, as you press down, their body goes down and it won't compress the heart properly. Floor, yeah. It's just that for you, it's easier not to get on the floor, but that's just to protect your back. That's not like, yeah, floor fine. Bigger child, you always go to the floor, but baby just is easier. Absolutely. So if you don't have any more, oh yes. Same sort of thing. You get the danger. You still apply the same. No matter what the situation, you apply the same response. Danger. Get them out of the pool. Check for a response, which you might get them. Send for help. Open their airway. And in this case, you probably have to turn them on their side because there'll be water coming out. And then you go back to following the rest of the algorithm. Breathing, CPR. Yeah, exactly the same. You apply this to any first aid situation. It's just that at certain points you'll stop because you found they woke up or they were breathing, so there was no need to continue. So you apply that no matter what the situation, and you'll always be covered. All right? All right, well, thank you for your... No, no. If you happen to be like over here on the wrong side, you might break a rib, but you know what? Bones heal. So, and just always position center of the chest, bottom half, and you'll just, you will be, any attempt's great. All right, well, thank you for your company. See you later.